In this video, we will be discussing the congenital heart disease condition known as bicuspid aortic valve. You may wish to view our video on the normal heart before watching this video. The aortic valve is located between the left ventricle and aorta. Blood is pumped from the left ventricle through the aortic valve and into the aorta from where it travels around the body. A normal aortic valve is made up of 3 leaflets. These leaflets open to let blood out of the heart and then close to prevent blood returning to the heart from the aorta. A bicuspid aortic valve has 2 leaflets rather than the usual 3. 1 to 2 in every 100 people are born with a bicuspid aortic valve, and it can be inherited in some families. Bicuspid aortic valves can function normally and never require any treatment, but in many cases, the function of a bicuspid aortic valve deteriorates over time, becoming either narrowed or leaky or both. Narrowing of the aortic valve is called aortic stenosis. In aortic stenosis, the valve does not open as well as it should, and this means the heart has to work harder to pump blood to the body. Mild or moderate aortic stenosis is usually well tolerated, and regular observation is all that is required. But when aortic stenosis becomes more severe, the muscle of the left ventricle may become thicker to enable it to pump more forcefully, and patients can develop symptoms such as breathlessness, chest discomfort, or feeling dizzy, or even collapsing when exerting themselves. Leaking of the aortic valve is called aortic regurgitation or aortic incompetence. Here, the aortic valve does not close properly, allowing blood in the aorta to return to the left ventricle. If severe enough, the blood that leaks back into the heart causes the left ventricle to enlarge, and, if not treated in time, this causes the pumping function of the left ventricle to become impaired. In many cases, a bicuspid aortic valve becomes both narrowed and leaky, and this is referred to as mixed aortic valve disease. In addition to problems with the function of the aortic valve itself, it is common for patients with a bicuspid aortic valve to develop enlargement of the aorta. This is called aortic dilatation. This doesn't affect the function of the heart as such, but if the enlargement becomes severe, there is a risk of the aorta tearing, which can be life-threatening. When either aortic stenosis or regurgitation becomes severe, treatment may be required. Occasionally, it is possible to treat aortic stenosis in a keyhole technique called aortic balloon valvuloplasty, which avoids the need to open the chest in an operation. In an aortic balloon valvuloplasty, a balloon is passed through the aorta to the aortic valve, where it is inflated. The expansion of the balloon forces the valve open. In most cases, both aortic stenosis and aortic regurgitation require replacement of the aortic valve by open heart surgery. Depending on the situation, there are a number of potential options for surgical aortic valve replacement. Most commonly, the diseased bicuspid valve is removed and a new artificial valve is sewn into place directly. There are 2 types of aortic valve replacement. Mechanical aortic valve replacements are made of carbon and metal. They can usually last a lifetime, but require lifelong blood-thinning treatment with warfarin to prevent dangerous blood clots forming on them. A tissue aortic valve replacement is made of animal, usually pig or cow tissue. The advantage of tissue valves is that they do not require lifelong blood-thinning treatment, but the disadvantage is that they have a limited lifespan, especially in younger patients, and so often require replacement in time. The most appropriate valve type depends on a patient's individual circumstances. In certain situations, an alternative operation, the so-called Ross procedure, may be appropriate, and we explain this in a different video.